Premiums way up, insurers getting out, leaving more than 2 million Americans scrambling for coverage. And the sticker shock is already setting in. Tennessee, Mississippi, Kentucky, all reporting that Obamacare premium spikes for 2017 go as high as 62%. To Betsy McCoy, author of Beating Obamacare, the next round of enrollment for Obamacare starting just before the election. How bad is this thing going to get?
Well, it's very bad. Obamacare is in a death spiral. You're going to see very high premiums across the board, about 23% this year, but in some states, as you pointed out, 50% in Illinois, 60% in Tennessee. In addition, for those who buy these plans, much narrower networks of doctors and hospitals, fewer choices of prescription drugs, and in some states and counties, about a third of the nation, only one insurer left on the Obamacare exchanges. And here's what happened. If there were 4 or 5 insurers and now there's only one, all the people that were in all those insurance plans are funneled into that one remaining insurer plan, and they will never be able to get a doctor. They're all calling the same doctors, and they're not getting appointments.
Right. There's 70 in a group of states, 18 states in D.C. that McKinsey looked at. 75% of the offerings are HMOs or the even more narrow, the exclusive provider organizations. That's up from about 55% just 2 years ago.
Here's why it's failing. This law tries to force healthy people to pay the same amount for insurance as chronically ill people. But we know that 5% of the people in the country use 50% of the health care. This is like trying to feed a Chihuahua and a Great Dane on the same budget.
These are healthy people.
It doesn't work.
Who literally have to pay a monthly premium of maybe $500, $600,
even more,
and then have a $5,000 deductible.
Oh, it's going to be $7,000 for the cheapest plan this year. The deductible for the bronze plan, $7,000 per person. And one indication of what a bad deal this is for anyone except the chronically ill or people who get a totally free ride of 100% subsidy is that already 11 million people are paying the penalty instead of signing up for Obamacare. More people are paying the penalty to stay out of Obamacare than are in it.
This is what's happening. It's the if you love your doctor, you can keep him, which is just an outright lie. You have women, say, for example, who are pregnant now, who their insurer is moving out of a state because they can't afford to offer insurance in that state anymore. And so they're looking at having to change doctors and find a different OBGYN the month that they're delivery.
Or how about if your child has epilepsy or another chronic condition and you've depended on one doctor all this time and now you're hit with no doctor at all.
Well, how do you
it's a
fix
terrible
it then,
thing.
Betsy?
Because
the Democrats want single payer. They want single payer, period.
And that's not going to happen because 165 million people, most of the people in the nation, get their insurance at work. We're talking about 10 to 11 million people in these exchanges. But the first thing the next president of the United States must do on day one is to suspend the penalties. 11 million people already paying penalties. It's going to be 12 or 14 million this year. Big penalties, $1,000 or more. Why should they pay a penalty when they're faced with no choice, soaring premiums, outrageous deductibles, none of the things that were promised with this law?
Betsy, it was good to see you.
Thank you.
Thank you so much.